So some of the treatments that we offer, it really depends what the patient is here for. We have two types of patients. One of the patients may come in, it's more of aesthetic. They don't like the way their legs look and they can't wear shorts or go to the beach. They feel embarrassed by how their legs look. The other is how their legs feel. They have symptoms that are precluding them from doing certain activities, so it's not an aesthetic thing, it's more of a medical issue, and we deal with both types of patients. The treatment depends who is the patient and what they're looking for. So aesthetic, we do the cosmetic sclerotherapy. If it's medical, there's several treatment options to treat vein disease. Some of these medical treatment procedures are your radiofrequency ablation, endovenous ablation, where you're using heat to close the vein that's causing your symptoms. We also do ultrasound guided sclerotherapy, and I usually say we use those to close the branches of those veins that are causing issues and symptoms. And then once you take care of the internal, then we go, if they want to continue taking care of the aesthetic, we usually leave that for the end, because you got to take care of the internal before the external. There are other types of treatment modalities. One of them is VenoSeal, which we're using a glue to close the vein, and with that you don't have to wear compression stockings, and several other modalities. The modalities depends on the patient, their lifestyle, what we find on the diagnostic, ultrasound, and which modality their insurance is willing to also cover. So if their insurance does not cover, approve, the glue, which is more of a newer modality, we have an option to do endovenous ablation, for example. But every patient is different. It depends on their anatomy, what we find, and their lifestyle, and we have a full discussion about this with the patient once they complete their diagnostic ultrasound.